Hi, good evening, everyone. I am Dr. Richa Mittal, consultant, pulmonary and sleep medicine at Sir H.N. Reliance Foundation Hospital. So today I'm going to talk and discuss about the topic sleep apnea, what, why, and how of this disease. Now, sleep is such an essential part of our life. We spend almost one third of our life in sleep, and still it is so less spoken about. And that is the time when our body actually rejuvenates, it recovers from the whole stress that has occurred during the daytime. It is the time, like how you charge your phone, that is the time that your body is getting recharged for the next day. It regularizes the whole body's function, especially it has a huge impact on the proper functioning of brain and heart. So it's a very integral part of a hearty, healthy life. We talk so much about good diet, healthy diet, especially among the youth. The discussion is around healthy diet, regular exercise routine, but sleep is also a very essential part of your life. So today we are talking about sleep apnea. What do we mean by apnea? Apnea is basically cessation of your airflow. Now, when you breathe normally, regularly what happens that the air goes from the nose to your throat and ultimately to your lungs. What happens in sleep apnea? Sleep apnea is basically characterized by multiple pauses during this regular breathing, which makes it irregular. And these episodes can happen multiple times during your sleep. What happens is in sleep apnea, there is a failure of the muscles of the throat to keep this airway open. So it obstructs, there is a blockage. And that's why the airflow is not very smooth. It's an obstructed airflow, which leads to drop in the oxygen in the body during sleep. Now, this drop in oxygen is perceived by our brain and reflexly our body tries to restore normal breathing, which causes us to wake up. So the patient experiences frequent awakenings and it disturbs and a poor sleep quality and life. So how does a patient present to us and what are the main symptoms of sleep apnea? Now, many a times patient doesn't even know that there is a problem and patient doesn't even come with the complaints. It is the bed partner that comes with the complaints. So the bed partner has a huge role to play in sleep disorders. So the bed partner will come that the patient is snoring very loudly, his or her sleep is disturbed because of his snoring, and that is what makes the patient and the partner come to our clinic. So, and the other prominent symptom of sleep apnea is excessive daytime sleepiness. Now, what do we mean about excessive daytime sleepiness? Is basically that patient feels sleepy and gets tired easily, and wherever he can, he will try to doze off. Now, in situations where he's not expected to, like situation like he's just sitting and reading a book that is of his interest, and he will just doze off. He will be sitting in a public place, inactive, and he will doze off while going in car for long hours and for long journeys. He will just doze off, and wherever he can, while watching a movie, sitting and watching a movie, in the nap the patient will feel a strong urge to sleep. Now sometimes this is perceived by the patient as that this is very normal. Snoring is normal, even sleeping anytime any part of the day is normal, and that actually he can sleep well. But no, these are very prominent symptoms of a patient, of a person suffering from sleep apnea. The other subtle symptoms are that the patient will feel dry mouth when he wakes up in the morning or itchy throat. He will get up frequently to pass urine during the night time. He'll feel extremely tired during the daytime. There will be poor alertness. There will be lack of energy, and he'll get tired easily. Even doing trivial work, he will get tired very easily. These are other symptoms. And also sometimes the bed partners witnesses that there are periods or there are for few seconds the breathing will stop, or the patient will experience that patient is getting up choking or gasping. So these are the more prominent signs. But ultimately, there is no one single symptom that points towards sleep apnea. There is always a constellation of symptoms that point. So we need to look, we need to know about these warning signs and symptoms so that we can address them quickly. Who are the patients who are at risk of this disease? Sleep apnea can occur at any age. It's even in children it is seen, but it is more prominent and it is more common in middle age and elderly, especially above 40 years. It is more common in males. It is more common in the most common risk factor is obesity. So the more the obese the individual is, the higher the chances that the patient will have sleep apnea. The patient who smokers are at 3 times higher risk than the general population. Patient who take sleeping pills and people who are addicted to alcohol, If they have sleep apnea, their condition can get worsened because what these drugs or what alcohol does is it depresses the respiratory system, so the patient cannot breathe that well. So it exacerbates the whole disease. So they are at risk. And sometimes it is the anatomy of the face and the airways. So some people will have small mouth or small face, and the bones of the face are structured like that the airflow will be obstructed. Some people can have blocked nose because of which the airflow can be obstructed. Some people can have large tongue or large tonsils or long uvula that is present in the throat. So these are some of the risk factors that that a person can have, which can, such patients are at risk of getting sleep apnea. Now, why are we even talking about sleep apnea? Is it dangerous? Yes, it's a very serious condition. Why? Because sleep apnea has both short-term and long-term effects. Just to enumerate few, in the short-term effects, the person will not have a good sleep satisfaction. The quality of sleep will be very poor. When he get up in the morning, he'll be very groggy. He'll get tired easily. There will be poor alertness because let's remember, sleep is the time where the body parts regularizes, and it also helps elevates the mood, energy, and makes you more productive. So it is very important that the person gets a good night's sleep. So these people will experience daytime fatigue. They will get tired easily. There will be poor alertness. There will be poor memory. There will be poor productivity while working. And there will be poor judgment in these patients. And these patients are more at risk of car accidents also, because the reflex time is actually longer for such people and they are more prone to getting car accidents. In the long term, what are the effects because of sleep apnea? Now, sleep has a huge impact on brain and heart. So these are the organs that are affected the most when sleep apnea occurs. So such patients are more at risk of heart attack, heart failure, irregular heart rate, stroke, that is the paralytic attack, uncontrolled blood sugar levels, sexual dysfunction, and it can affect each and every part of the body. So sleep apnea has disastrous effect, and that is why you need to be aware of the symptoms and address it as immediately as possible. Now, when should you consult a doctor? Definitely, when you are experiencing such symptoms, you should consult a doctor. And what a doctor will do, what the sleep specialist will do, they will evaluate your sleepiness objectively and subjectively. So for subjectively, we have the symptoms. For objectively, we have some scores which are easy to fill and to enumerate. The Epworth sleepiness score is one of the scores that is easily available, which any of the patient is experiencing symptoms can go through the test, and if it's above 10, that just suggests that the patient might be a patient of sleep apnea. So that is the objective score. And if the doctor feels that the patient is at high risk and is suspicious of sleep apnea, then they will order a sleep study. Now, the sleep study is available both. It can be done in the lab, in the hospital settings, or at home also. But at home should be only after a physician's consult. Why? Because they're only in certain conditions that we order a home-based sleep study. There are certain conditions where the home-based sleep study will not show good results. So it's always preferable to get your sleep study done in the hospital. What we do in a sleep study, we hook the patient, different leads are put, we hook the patient to the machine, and the patient has to just come and sleep in the bed. And while sleeping, what we do, we evaluate the brain function, the stages of the sleep, the airflow, the pattern of breathing, heart rate, the regularity of the heart rate. So overall functioning of the body during the sleep is evaluated, and this sleep test is known as polysomnography. Now, what is the treatment? Coming to the treatment of this disorder, if we do a PSG, that is the polysomnography sleep test, and if we find the patient has mild sleep apnea, then what we ask the patient is just lifestyle modification. Lifestyle modification as in, because it is more common in the obese people, we ask the patient to lose weight, modify the diet, a more healthy diet, regular exercise routine, a good sleep hygiene, a good sleep schedule, that is going to bed at an adequate time, getting up at a regular time, avoiding alcohol, avoiding sleeping pills. So these are some of the measures that we do in a mild sleep apnea patient. But usually the patient come to us in the moderate or severe condition. What we do in the moderate or severe condition, we treat the patient with CPAP therapy. What is CPAP therapy? It is continuous positive airway pressure therapy. And what was happening in sleep apnea? That your throat was getting blocked, so the air was not passing through smoothly. What does this machine do? This machine with the positive pressure, it open up the throat. so that the air can go in smoothly, your oxygen levels won't drop during the night, and you won't have the disastrous effect on your body. So the CPAP machine basically opens up the blocked airway, it keeps it more patent, so the airflow can be much more smoother. So that is the most effective therapy, and that is the therapy, ideal therapy for the treatment of sleep apnea. So to end this, I would just like to say that sleep is a very integral part of the life. We tend to neglect it, we tend to overlook it, and we glamorize these days that sleeping less will actually make you more productive, because we glamorize hard work, we make glamorize lack of sleep, but a good amount of sleep for an adult is necessary for a proper functioning of your body and for a hearty, healthy life. So sleep well and live well. Thank you.